it's the best place in the world to go to an emergency room for. But as far as chronic conditions go, we spend more than twice the amount per capita than most other developed nations, and our outcomes just aren't that good. When you're dealing with chronic issues, the way the current method does it is it bases it on diagnosis. It basically takes the signs and symptoms you had, puts a diagnosis to that, and then with that diagnosis, a game plan is established based on the diagnosis. There's some problems with that. A lot of times the game plan involves suppressing the symptoms rather than getting to the root cause of what's actually causing the problems. It has a strong reliance on pharmaceuticals, and I think that's where an awful lot of the cost comes from. And I think it's also where a lot of some of the risks of the current modality come from. So, what about the root? The slide kind of exemplifies what I'm talking about here. If you are treating the symptoms rather than going to the root cause, you're kind of mopping up the wet floor while the sink is still running over. What functional medicine tries to do is basically find out what's the running sink. How can we turn that water off so that we can actually get to the root of the problem, sometimes completely arrest or resolve the issue so that we don't have to continue mopping for the rest of our lives. So the traditional model assumes that everyone with the same disease has the same issues and will respond to the same treatment. And the reality of that is it's just not true. And functional medicine and integrated medicine shifts the focus away from the suppression towards finding the underlying causes. And as an example of that, the next slide shows the causes of obesity. And they've got 5 different causes up there that can all lead to obesity. And once a person's reached that state and has obesity, they can have 5 different expressions of the obesity there. And to use another example, one of the common diagnoses that we see in clinic is irritable bowel syndrome. If I see 5 different people with irritable bowel syndrome, they can have 5 different causes. One of them can have an infection in their gut. Another one can have a toxic exposure, something like a mercury exposure, an exposure to persistent organic pollutants. Another person can have a dysbiosis where they've got the wrong bacteria growing in their gut. Another person can have a hormone imbalance. And I can't treat all of those people the same way. If I do, I'm not going to have any success in actually getting rid of the cause of that disease. And in the same vein, once that person has been exposed, then basically how we go about following through with that treatment plan makes a big difference as well. So the outcomes are going to be different. The exposures, the genetic makeup of that person is going to create a different outcome. Their environmental exposures are going to create a different outcome, and we've got to personalize that. We've got to take a look at both the genetic factors and the environmental factors to be able to actually come up with what the causes are. Okay? So what is functional medicine? It's a science-based, personalized care approach that assesses and treats underlying causes of illness through individually tailored therapies to restore health and improve function. Genes equal outcome, or do they? Well, when they started this gene revolution, and they went out to basically find out all the answers about what the causes of disease are when they started researching genes, they found out that actually it's not just your genetic makeup. Genes are important, but they're really only about 30% of the picture. How those genes interact with your environment makes up the other 70%.